everyone, and I extend a very warm welcome to all of you for attending this session. And the very fact that you are here, that means you are either you have given or you are planning for either part 1, part 2, or part 3 MRCOG exam. An MRCOG exam, which stands for Member of Royal College of Obstetrician and Gynecologists, it can be considered as a gold standard qualification in the specialty of obstetrics and gynecology. And it also acts as the passport to the peak of your profession. So lots of people, they are planning for MRCOG exam, and this is basically a 3-part assessment which comprises of part 1, part 2, and part 3 exam. And we shall be discussing about all this today. So let's begin. So is it easy? No, not at all. It is not easy at all. Because the 3 parts of the exams, they are difficult, and the pass percentage for part 1 though is 70 to 80%, but I still know of many people who struggle with passing even the part 1 exam. The part 2, the pass percentage itself is 10%, and I know so many people who have struggled passing the part 2 exam. Failing 4-5 times, it is a very normal phenomena for part 2 exam. So there's a lot of hard work, lot of stress, lot of preparation, lot of dedication, lot of efforts which are required from your end to make it through the MRCOG journey. And it's not at all easy, but is it worth it? Definitely yes, it is worth it, absolutely, because MRCOG degree itself is a very prestigious degree. And why should you go for it? Again, I must tell you that I'm a very patriotic person, and I will not encourage people to leave the country and go to other nations. But the fact is that getting MRCOG degree and practicing abroad for few years and gaining the expertise and getting acquainted with international standards of patient care will always be helpful for you in your practice in India also. So that is the reason I encourage the MRCOG exam. And like I mentioned previously, that this is an international degree. It opens avenues for you to practice worldwide. So you can, once you get MRCOG degree, not only you can practice in the UK, but also in countries like Australia, New Zealand, the Southeast Asian countries like Hong Kong, Singapore, Malaysia, Indonesia, South Africa, Middle East, Saudi Arabia, Qatar, Bahrain, Kuwait, all these countries you can practice, even Canada, Ireland, one can practice. So again, international experience, international medical experience will add to your expertise further. So I think it is definitely worth it. Secondly, it also demonstrates your pursuit towards continuous professional and personal development. So if you're pursuing MRCOG, it means that you are striving towards excellence in patient care, towards achieving excellence in patient care. Again, MRCOG, it caters to international standards of patient care. So when you prepare for MRCOG, obviously you get acquainted with all those things, and you also start practicing holistic patient care. So that means taking patient as an individual as a whole and not treating a particular organ. So definitely this journey is worth it. So now I can see a lot of audience in the webinar. So I encourage all of you to please introduce yourself on chat. I would like to know your details. Where are you right now working? What is your level of experience you are giving? You are in your MD first year, second year, third year. Which part of the exam are you preparing for? What are your challenges? What are your experiences so far? So please do mention it. So hi, I can see lots of messages. This is Dr. Sai Neha. So I can see they are second year residents. Hi, Dr. Tejas. They are first year residents. There are consultants who are, I know everybody is striving towards the MRCOG journey. So please also tell me, I can also see that most of you they have prepared or they have given part one. So I don't see a lot of candidates for part one, but I do see lots for part two. And I know, like I mentioned previously, part two is it's not slightly, it's actually a difficult exam. Hi, Dr. Kush. Hi, Dr. Ramya. Hi, Dr. Fatima. So, tell me about your experience, how difficult or how hard or what is the challenge which you are facing? Hi, Dr. Chabria. Hi, Dr. Ravi Kumar. So, the main challenge I see is MRCOG Part 2. And as I told you, the exam is a little difficult and the pass percentage is very less. It's only 10%. So out of 100 people, you know that 10 people are going to pass only. So rest 90 people are going to fail for sure. So you have to develop that in your mindset that it is completely normal if you fail once or twice in your MRCOG Part 2 exam. I know it sounds a little funny when I say that you flunk in the exam, but this is something which is normal. Most of the people I know of, they have given 4 or 5 attempts before they actually cleared their Part 2. So Dr. Kush Mehta says, I have no idea about MRCOG. That's absolutely fine. You're more than welcome. You'll gain all the knowledge related to MRCOG. And I believe you must be having some background in obstetrics and gynecology, and that is why you are interested in this. So just to briefly tell you or to briefly address those people who have no idea about MRCOG. MRCOG, again, I'm mentioning the full form is Member of Royal College of Obstetrician and Gynecologist. And this is a 3-part exam. So basically, you have to give MRCOG Part 1, MRCOG Part 2, and MRCOG Part 3. We'll be discussing in depth about what exactly is involved in each part of the exam, how the exam pattern goes, what is the structure of practice in the UK, and what all do you need to do, what is the exam pattern, what kind of questions come, what is the syllabus, and so on. So this was the general introduction. Maybe now if any of you have any specific questions, I encourage you to please put it on the chat because we can take those questions and then after the questions, I'll go on with the webinar per se.
Dr. Aarti in the chat box is asking that is it possible to get through the part one exam during Obs Gynae residency itself, like given the hectic schedule and residence we have?
If you are able to study even with your hectic residency schedule, Dr. Aarti, if you are able to put in even 1 to 2 hours every day, because see, part one is not really clinical obstetrics and gynecology, it is more of basic sciences. So you'll have to study anatomy, physiology, all the first prof and second prof subjects, and which at my time I had forgotten most of it. So it takes a little effort to get back and to study those things. But if you feel you can manage it with the hectic schedule, then you can go for it because it's a relatively easy exam. And even if you put in a little effort, you will be able to, because anything which is asked, even the basic sciences that is pertaining to the clinical subject of obstetrics and gynecology. So even if they're asking some question in anatomy or physiology or microbiology, that will be pertaining to obstetrics and gynecology. So I will recommend you to go through it.
Dr. Julie Hansa John has also asked a question. Can you share the insights into the type of questions asked in the exam?
Okay, so the pattern of part one is basically something which is known as SBA or single best answer. Now, most of you may not be used to what an SBA is. We'll be again talking in depth about what exactly is SBA. So you can consider it as something like an MCQ. Okay, and what difference MCQ and SBA have, we'll discuss it further. But it is usually in form of SBAs, and part two is SBAs and EMQs. So you don't have short answers. You don't have to write paragraphs, and it's not like that, or no fill in the blank type of questions. It is mainly SBAs and EMQs, and we'll be discussing about that in depth. Part three is more of communication skills. So it is mainly in form of OSCEs. Then I can see a question by Dr. Kaur, Dr. Hari Simran Kaur. What is the cutoff for passing MRCOG Part 1? So, Dr. Kaur, there is no cutoff per se. How they mark the MRCOG Part 1 is basically it is a percentile system. So whatever paper comes for everyone, what they have done already is they've given that paper to some UK graduates, maybe 1,000 students, and whatever average they get from the UK graduates, that they set it as a passing mark. So, for example, if it is a moderately difficult paper and the passing percent which the UK graduates get is about 65%, then they'll set the passing parameter as 65%. Next time, the passing parameter could be 70%. So it varies every time. But on an average, if you get nearly 60 to 65 percentile or 60 to 65% marks, that should work. And that usually helps you clear the exam, the part one. Also, there's another thing that each question will be marked differently. So there'll be some easy questions which will carry fewer marks. There'll be some difficult questions which will carry more weightage. And especially those questions where, the life of mother or the baby could be threatened, those questions, they'll be carrying more marks. So again, the scoring for part one and both for part two, something similar is there.
Then Dr. Ramya is also asking if where and how to start study for part one, if you can share your tips and tricks.
So where and how to start studying for part one? How to start studying is because basically the subject of obstetrics and gynecology remains the same. Whether you're practicing it in India or you're practicing it worldwide, any country, the subject remains the same. All what you need to do is develop a different orientation and get an idea about the healthcare system in the UK. That is all. So if you're, I don't know what you're doing right now. So if you are in your residency program, this is the best time to think. If you are planning to give planning to give the MRCOG exam, this is the best time, I would suggest. The tips and tricks I will be sharing through the session as I take it.
There is another question by Dr. Ravi Kumar. Kindly guide for the sources for part two. And the Jan session had 69% cutoff for part one.
That is what I was telling you, that it varies and it is somewhere between 60 to 65. Sometimes based on the paper, if it is a very difficult paper, then the pass percentage becomes less because then the average pass mark even in the UK graduates will be lesser. So then it might be 60. But if it is a relatively easy paper, it might be 69, 70, 75%. So it varies. If you are preparing for part two, the best thing I think what you should start doing is the GTG guidelines or the Green Top guidelines. They are available for free on internet. So you should, while you are studying any topic, I believe you must be doing your MD right now. So whatever topic you are preparing, you also simultaneously study the GTG guidelines. GTG guidelines, the NICE guidelines. The NICE guidelines are also available free on internet. It can be downloadable. If you want, RCOG offers some courses. You can join that. There are other players also who are offering courses. You can join that. But I would suggest that the best thing to start doing is to start going through the GTG guidelines. And if you can get access to the TOGs or the Obstetrician and Gynecologist, which is the peer-reviewed journal, that also, or the articles on BJOJ, the British Journal of Obstetrics and Gynecology, that is also very helpful. So there is this interesting question. Can you please tell me what actually life will be after MRCOG in UK? Life is always tough. So life is never easy, Dr. Neha. But yes, you will get exposure to the UK style if you once you have cleared MRCOG, and we'll talk about that, and you plan to practice in the UK and you enter the specialist register, then you'll practice as a consultant in UK. So this is the difference between MRCOG and PLAB. With PLAB, you enter the entry level posts. So you have to start as an SHO, which is the entry level post. So you are not working as a consultant when you give PLAB. But when you give MRCOG and you are able to clear MRCOG and you are able to enter their specialist register, then you work as a consultant in the UK. And obviously, you would have had super specialty training by that time.
She's asking, she has filled the eligibility form for MRCOG Part 1 in 2020. She wants to know, can I give the expression of interest alone now, or should I redo the eligibility form?
There's no need to redo the eligibility, I believe. If you have filled in the eligibility and it was accepted, you got some answer from the RCOG, you got a mail or something, then it is fine. You need not fill it again. Okay, the expression of interest you can go ahead with right now. We'll talk about all these things in depth later because I believe the audience must be wondering about what these things are, but we'll be touching upon all these things. Okay. Uh,
Dr. Ariti is also asking, can we become consultants abroad if we pass the MRCOG Part 3 exam?
uh, we'll discuss that in depth, Dr. Aarti. So we'll discuss about that.
Dr. Sadaf wants to know if we can recommend some study material and resources available for the preparation of exam.
I just mentioned few resources. Also, sorry, I forgot that I also conduct this thing, study program. So you can, if somebody wants to join that, you can consult the marketing team. They will be, I think, available after the session. And plus the free resources I mentioned to you, if you are interested, you start going through that, you will gain a lot of knowledge. And you'll also start understanding a little about the UK structure, the NHS structure. That is what is more important. How the healthcare system functions in the UK. It is very different from what happens in an Indian scenario. I believe you must be from India. So in an Indian scenario, the things are a little different. There, everything is taken care by midwives, and the first level of care there in the UK is the GP or the general practitioner. And each trust will have a general GP practice, and they will be referring the patients to the hospitals. So the structure is quite different there. So that is what you need to understand if you are giving part one, part two. Then there's a question Dr. Neha is asking, with MRCOG degree, can we practice in UAE also? Yes, surely. You can practice in UAE because Middle East, many countries, most of the countries, they recognize MRCOG. The Arab board also recognizes MRCOG. So Dr. Pramod is asking, can we do super specialty in UK once we clear MRCOG Part 3? You'll have to go there and hunt for posts. Yes, you can do that.
Dr. Harsimran is also asking, if we don't want to settle in UK, will clearing the MRCOG benefit the career prospects as gynecologist in India?
Surely it'll be because the NMC curriculum or the NMC, the Medical Council of India, they also recognize the MRCOG degree. So it'll benefit you even in India. Can we practice in Singapore? Yes, you can practice in Singapore. Singapore, Hong Kong, Malaysia, Indonesia, all these countries recognize MRCOG.
Dr. Ziba is requested to highlight if there are any specific topics that are heavily tested in part 1 or part 2 exam.
So the topics, there are some 15 knowledge areas which are tested in MRCOG Part 2. We'll be discussing in depth about those topics. And surely there are certain things which definitely come. For example, there'll be surely a question from urogynecology. The various knowledge areas we'll be discussing in depth as we proceed through the session. I'll discuss in depth about those things. Then there's a question, how much should we study for preparation of exam to cover the whole syllabus? It completely depends on you. It completely depends on you, Dr. Pooja, how much time you need to cover the whole syllabus. Ideally, between 3 to 6 months are sufficient for part 1, but again, it depends on how much time you're devoting every day and how focused you are on your studies. Where can we give MRCOG Part 3? We'll discuss this in depth. MRCOG is membership exam and FRCOG is fellowship. So once you have got your MRCOG degree and you have attained some experience, then you can apply for FRCOG. FRCOG is obviously more prestigious than MRCOG. So structure of MRCOG exam, we'll be talking about it. Any other exam can be given simultaneously while preparing MRCOG Part 2, similar syllabus to excel in OBG. I believe you must be from India, I don't know, but or you must be practicing, you must be doing your MD. So while you're preparing, because like I mentioned to you previously also, the subject of obstetrics and gynecology, it remains same. So whether you are practicing it in any country, the cesarean section will remain the same. The content, the obstetrics and gynecology, that remains the same. You might be having some differences in the practice guidelines at various places, but otherwise the subject remains the same. And syllabus, there might be some things which might be more important in some countries and some things which are more important than the other, but otherwise,
There's a question by Dr. Srisha. After MRCOG, clinical experience in any country, is it sufficient to go for FRCOG?
yeah, but you should be
It's not.
registered with them. I mean, not registered with them, you should have cleared all the three parts of the exam. In any country, if you have clinical experience, you can get FRCOG. Don't worry about that. MRCOG is not recognized in USA. Sorry, Dr. Srisha. But it is recognized in Canada. For FRCOG, you don't have to give a special exam. If you are MRCOG and you have sufficient clinical experience, you can apply. There is a process which I think you can see on their website. There you have to apply to the college that you want to seek FRCOG, and then if they feel that your experience is sufficient, then they might award you with FRCOG degree. So I just mentioned to you that MRCOG is not recognized in USA. Anything else? For USA, you have to give USMLE and that's how you enter. So like many of you have been asking, because some of you, I believe, are not even sure of how exactly MRCOG occurs. So MRCOG is basically a three-part exam. So part 1, which tests your basic and applied knowledge in basic and applied sciences. So that means the questions which come in part 1 They are pertaining to obstetrics and gynecology, but they basically cater to the basic sciences. For example, anatomy, physiology, biochemistry, pathology, pharmacology, all these subjects, statistics, these subjects in relevance to the specialty of obstetrics and gynecology. So this is the first step because unfortunately the UK, they do not recognize your MBBS or your MD. So they want to see that, yes, are you capable enough to become a specialist? So MRCOG part 1 is basically to do that. Once you've cleared part 1, then the part 2 is testing your clinical knowledge in the subject of obstetrics and gynecology. So part 2 is basically your clinical knowledge, test of your clinical knowledge. One thing again I want to highlight here that to give MRCOG part 1, you all the eligibility criteria is just that you need a medical degree. You do not require to be an MD in obstetrics and gynecology to be able to give MRCOG part 1. Even for MRCOG part 2, you do not require to be an MD or OBG. It's just that the level of paper is such, part 1 and part 2 both. Part 1 is relatively easier than part 2, but level of both the exams is such that if you do not have clinical experience in obstetrics and gynecology, you might find it very, very difficult. But you need not be an MD, I'm repeating again. But for part 3, you need 4 years of clinical experience in the specialty of obstetrics and gynecology. So 4 years experience is required in this case. And this 3, if you are an MD in OBG, then 3 years of your residency program also gets recognized. Or even if you're not MD and you have 4 years of experience in OBG, that is sufficient. And part 1 and part 2 are written, I mean, they are computer-based exams, which are like MCQ-based, SBA or EMQ based, whereas part 3 is a verbal exam. It is an OSCE based exam and it basically tests your communication skills. So this is the training structure in the UK. It is slightly complicated, but I'll try to simplify it as much as I can. So like in India, what happens is we complete our MBBS and then we apply for the competition, which is the PG NEET. And once you get a seat in that and you get a good rank, then you choose the subject of your choice. And suppose you get MD OBG, then 3 years you continue in that specialty. And at the end of 3 years, then you have an exam and you get MD OBG. In UK, the structure is slightly different. One, it is more flexible. So you can decide whether you want to go ahead with OBG or not. After 6 months, you can change your specialty. Suppose you are not very happy or you feel that OBG is not your subject and now I want to change, so you can do. You can choose maybe your specialty training in pediatrics. So FY1 and FY2 is basically foundation training, which is, you can consider it as internship. So after your internship is over, this is a UK pattern, what happens. So then you decide that, okay, I've finished my MBBS, my undergraduate training. Now I want to pursue with my specialty training. So now I want to pursue my specialty training. Say I decide in obstetrics and gynecology. So I start applying to various hospitals, various trusts. And if I get selected, then the first post will be ST1, which is Specialty Trainee 1, Year 1. And once I've fulfilled the competencies which are required for ST1, then I can progress to ST2. And then from ST2 to ST3, ST4, and ST5. So if I suppose manage to finish ST1, which requires some competencies, maybe in 6 months, I can move on to ST2. I may take lesser time for ST1, or I can take more time. It is completely flexible, but I need to finish those competencies before I can move to the next level. So the training duration is not fixed as in India, that 3 years. I can make it as little as possible if I complete all the competencies very quickly, or I can make it as long as possible if I take very long time to complete the competencies. Okay. Then what happens is that from ST1, I go to ST2, ST3. Now, suppose after doing ST1, I realize that no, obstetrics and gynecology is not the subject for me. I want to pursue pediatrics. Then I can look for a trainee post in pediatrics and continue the specialty training in pediatrics. So I can switch at any time. It is very, very flexible. Now, if I'm pursuing my specialty training in obstetrics and gynecology, then while I'm pursuing my training between ST1 to ST5, I have to give 3 parts of my MRCOG exam. This is the training structure in the UK, if I'm practicing in the UK, because you need to understand that if you have to practice as a consultant in the UK. So, the training is classified into 3: basic training, intermediate training, and advanced training. And this completely is known as the core training. So, after ST5, I move on to ST6 and ST7, and that is the advanced training. And ST1 and ST2 is the basic training. So basic training basically means that you are able to handle most of the emergency and non-emergency related situation in obstetrics and gynecology, but you require supervision. Intermediate training is that those supervision is there, but you are able to independently handle most of the emergency and non-emergency situations in obstetrics and gynecology. So ST1 and ST2, you can consider it as year 1 of MD, and ST3, 4, 5 can be considered as year 2 and year 3 of our MD, the Indian MD I'm talking about. And ST6 and ST7 becomes like our senior resident, most likely. Not really, because ST6 and ST7 in the UK, they basically will be doing super specialty training. And at the end of ST2, you are supposed to give part 1 there. You can give it any time, but they feel, what the RCOG feels is that at ST2 level, you are competent enough to be able to give part 1. If you give it at the level of ST1, you may not be competent enough and you may not be able to clear the exam. That is what they feel. After completion of ST3, ST4, and ST5, you need to give part 2 and part 3 of the MRCOG exam. And only when you have given part 2 and part 3, you can progress on to ST6 or advanced training. Again, at ST3 or ST4 level, also you can give part 2 and part 3, but you may not be competent enough at that time as per the RCOG. So they recommend that after ST5 only you go ahead with part 2 and part 3. Then in the advanced training, there can be 2 types. One can be ATSMs, which is advanced training skill modules, or it could be the subspecialty training. So what are these 2 things? I'll just tell you. So advanced training skill ATSMs, which is advanced training skill modules. There are nearly 20 advanced training skill modules, and these could include things like menopause, medical, education, vulvar disease, oncology, colposcopy, complications of high-risk pregnancy. So there are 20 ATSMs and they could be these various specializations. So these are very niche specializations. Forensic gynecology is another one. And you can go, so you can specialize in either of these. Or there could be the subspecialty training, which is a little less niche. And these basically include 4 subspecialties, which is urogynecology, oncology, maternal and fetal medicine, and reproductive medicine. Okay, so I hope you have understood the structure of training in the UK. If there are some doubts, you can please put it on chat. So coming to the process of exam application. Application for either part 1 or part 2, it comprises of these steps. Which is first you have to fill in the eligibility form. Eligibility form can be downloaded from the RCOG website. You fill in the eligibility form. So eligibility form is basically they want to check whether you are eligible to give the exam or not. There was a question from one candidate. She had asked if I have filled the eligibility form in maybe 2020 and now I want to give expression of interest. Can I do that? So, eligibility form, they are testing whether you are eligible to give the exam or not. It is available from the RCOG website. You can fill in this form. First step which you need to do before you fill in the eligibility form is that you need to open an account with RCOG. So you go to the RCOG website, and in the RCOG website, you can click on register and you can open an account with RCOG. Once you've done that, then you get a college number because they may ask in your eligibility form what is the college number. So then you fill in the eligibility form, you mail them. Then the second step is expression of interest. That once you're eligible, whether you are interested in giving the exam. So you say, yes, I want to give the exam maybe in the coming July session. So then you fill in the expression of interest form and they get to know that, yes, this person is eligible also and this person wants to give the exam also. So once the expression of interest has been submitted, then they will send you instructions to book the center. Now the exams are conducted by a company called Pearson VUE, which works for the RCOG. And this has centers all across the world. And they will be basically then connecting with you to fix the actual location where you want to give the exam. So initially you would be asked your country of choice. And once you've given your country of choice, then they'll call you and they'll ask you the place where you want to actually give your exam. And again, all these steps, they have timelines. So there will be a timeline where you have to fill in the eligibility form. Now for the upcoming exam in July, these are the timelines. And be sure that you meet these timelines because sometimes the seats are very few. And if they serve it on first come, first serve basis. So maybe if you're late, then the window will close, the booking window will close. So the good idea is to always keep a watch on the RCOG website And as soon as the booking window opens, you should book your place. And again, the eligibility and expression of interest also, based on the timelines which are given here, you must surely fill in those forms and submit it to the RCOG so that they can ask you to book your place for giving the exam. So the next coming up part 1 exam is 2nd July. Application process for MRCOG part 2 is also similar to part 1. The only difference is that eligibility for part 2 is that you should have cleared part 1. No clinical experience in obstetrics and gynecology is required for giving part 2. But part 1 should be cleared. And once you are eligible, that is, you have cleared part 1, then again you have to fill the expression of interest. Once the expression of interest has been submitted and it has been received by them, when the booking window opens for application, they will let you know. At that time, you can book your place, the country, and also subsequently the place where you want to give the exam. The coming part 2 exam is on 3rd of July. So part 3, again, the eligibility is one that you should have cleared the part 2. And also there's something called AOT. So you should have got your AOT approved. What is AOT? AOT is assessment of training. So you may have trained in any country besides UK. You may have trained in India, any country of the world. But you can get your training assessed. You can submit your papers which say that so and so person has trained in the specialty of obstetrics and gynecology. You can submit it to the RCOG if they accept that. And most of the places, most of the tertiary healthcare centers, if you have trained in, they will accept the training. And this AOT or assessment of training, this should be at least for 4 years training in OBS and Gynae practice. So 4 years of training in OBS and Gynae, out of which 2 years should be in the last 4 years. So if I'm applying, say now, then I should have 2 years of training should be in the past 4 years minimum. And my total training in OBG should be for 4 years. So again, these are the dates for MRCOG Part 3. We have the next coming up exam in May. And those of you who are interested in enrolling for our MRCOG Part 3 training program, for them, we'll have the interactive sessions in the month of March and April. We'll be having group discussions wherein the candidates can directly interact with the role players and with the mentor. And the next coming up MRCOG exam is in November. Again, there was a question and somebody was asking where the venue for MRCOG Part 3 is. So this is the answer, that for the coming up exam in May, the centers are Chennai, Malaysia, UAE, London, Delhi, and Singapore. So again, you should act very fast because the seats will be very few. So if you are in India and if you are Delhi based and you want to give it in Delhi, then be very quick, and as soon as the booking window opens, you should book your seat because it is again first come, first serve basis. There is a question by Dr. Priya. Will also AOT include residency? Yes, surely it includes residency. Your junior residency also is included. Your senior residency is also included. So this is the part 3. Now coming to the format of part 1. So like I discussed previously that the questions asked are in form of SBAs. SBA stands for single best answers. And there will be 2 papers in your part 1 exam. And it's a tedious exam because each paper is 2.5 hours long. Then there'll be 1 hour break between the two papers. So paper one is 2.5 hours, then there's a 1 hour break. Then paper two is also 2.5 hours long. And each paper will have 100 SPAs each. So a total of 200 SPAs. And you should not worry. And these are again computer-based exams. So again, this is conducted by the Pearson VUE. And Pearson VUE will be having centers all over the country. Across India, all over, I was looking at the centers, and even in places like Gangtok and Jammu, the centers are there. So almost all over India, the centers for MRCOG Part 1 are there. And this is a computer-based exam. So you go to the center, they'll check your initial details. And once your details are checked, you will be led into the small cubicle, which will have a computer, and the exam will be on that. And you have to give your answers. When you're giving your computer-based exam, you're also given an erasable board. So you can do your rough work, you can do your calculations, whatever you can do on that board also. So again, the part one, coming back to part one, I told you that this is basically your basic sciences and applied sciences, which are tested in this paper. So many of the questions will be very direct. Branches of internal iliac, branches of pudendal artery, the anatomy-based question, drug of choice, pharmacology-based questions, statistics-based questions. Now the tip, there was a question amongst the audience, the tips. There is a question by Dr. Sukrati. It has been 4 years since my senior residency completion. I'll be eligible for part 3. So you have been doing something else after you have done your senior residency. You will be having some clinical experience. No, if you don't, then I'm sorry, you may not be eligible. But if you have some clinical experience, then that you can add, because 2 years of clinical experience should be in the past 4 years. So you can give those details, because consultancy must, if it is private, they may not accept it. But if you're working as a consultant in some reputed tertiary care hospital, then they will accept it. So structure of an SPA. Now this is discussing the tips and tricks. Somebody had a question, what are the tips and tricks? So how to go about an SPA? First, let's talk about what is an SPA. So SPA has a clinical stem. Clinical stem basically means the scenario or the context, that this is the situation, and then the patient came with so and so problem, and then the lead-in question may be, how do you manage this patient, or what is the complication which is going to occur in the patient? That is the lead-in question. The clinical stem is the scenario. And options, for every SPA, there'll be 5 options, and only one answer is going to be correct. And you must remember that there would be several options which you might feel are correct, but there's only one option which is going to be correct. So Dr. Ravi Kumar, I'm sorry, I'm taking the questions in between because that is interrupting my flow also. But I'll take this question. 3 years MS, 1 year residency in medical college. Is this experience sufficient to take the part 3? Yes. 4 years, yes, it is sufficient. And if you have done it from some medical college, they will accept the experience. So coming again to the SPA, so this is an example, like I told you, this is the scenario that the woman had miscarriage at 9 weeks of gestation. The next day she had full blood count and her blood pressure is this much, her heart rate is this much. What is the management option? This becomes the question. This becomes the stem. This becomes the stem. This is the question, and these are the options. And only one option out of these would be correct. And other options are sometimes also known as distractors because they could be quite similar to each other. So the best way of attempting an SBA, as per my observation or as per my expertise or my experience, is that you should not look at the options. When you look at the question and the stem, you should think of the answer and don't overthink. Just think of how you deal with the patients in your normal day-to-day practice, how you deal with the patients in your OPD, how you deal with the patients in the ward, how you deal with the patients during your clinical rounds. Just think of that what if such a patient comes to you, what do you do in that scenario? So think of the answer, then you look at the options, and suppose you find whatever you have thought of as the option, then that is the correct answer. And suppose you cannot find something which you have thought of, then you look at the nearest possible option. In my opinion, this is the best way of solving an SPA. So for part one exam, the core curriculum or the syllabus, like I mentioned to you, that physiology, endocrinology, biochemistry, anatomy, embryology, genetics, biophysics, epidemiology, statistics, data interpretation. Data interpretation would include ECG interpretation, CTG interpretation. It will also include chest X-rays, CT scans, and all those things. Pharmacology, understanding illness would include immunology, microbiology, pathology, clinical management in obstetrics and gynecology. So this was part one. Let me take if there are any questions. So Dr. Pramod is asking, if I clear MRCOG 3, then will I be joining as ST6 directly? You'll have to apply there. They may ask, test your competencies and skills. If you fulfill them there, then you'll have to apply, and then they may take you at ST6 level. So 1 year in private hospital is, which private hospital? Some private hospitals, they will recognize. You'll have to submit your papers to RCOG. You can always mail them or you can call them, because on RCOG website, you'll get their number and their details. So you can always ask them. You can, in fact, mail them. You register with them, and then you mail them submitting your papers that this is the experience, 3 years MS, 1 year in private hospital, the details of the hospital. They'll let you know whether, and if it is a private hospital, is a tertiary hospital, then it should be enough. They will probably accept it. Okay. So coming to now MRCOG part 2. So part 2 is a tricky game. Part 1 is quite simple comparatively. Though I know of people who have flunked through part 1 also several times, but relatively part 1 is a simple exam. Part 2 is a known fact, it's a difficult exam. And the reason of the difficulty for part 2 is basically the EMQs, which are supposed to be very difficult. And the pattern is that, again, it is the same pattern. There are two papers, paper 1, paper 2. But paper 1 is 3 hours, paper 2 is also 3 hours. And in between paper 1 and paper 2, there's a break of 1 hour. And paper 1 will have 50 SBAs and 50 EMQs. And similarly, paper 2 will also have 50 SBAs plus 50 EMQs. However, when the marks come, 60% of weightage is given to EMQs and 40% weightage Like from paper 1, they'll take 50% of your mark, and from paper 2, they'll take 50% of your mark. But paper 1, 60% of marks come from EMQ and 40% will come from SPA. Similarly, from paper 2 also, 60% of the weightage will be given to the EMQs and 40% will be given to the SPAs. So the trick is that you should not spend too much time on doing the EMQs, or sorry, on doing the SPAs, because SPAs, it is 50-50. So you might tend to divide your time that, okay, out of 3 hours, 180 minutes to 90 minutes I'll give to SPAs and 90 minutes I'll give to EMQs. That is something which may go wrong, because EMQs will take much more of your time than SPAs. You should surely spend more time on the EMQs. So maybe these 180 minutes of each paper, you can divide it as 110 minutes into your EMQs and say 70 minutes in your SPAs. This is what the RCOG suggests, that 110 minutes you spend on EMQs and 70 minutes you spend on SPAs. I would suggest that if you can spend even lesser on SPAs, 50 minutes, if you can manage SPAs, it should be fine. And what I normally suggest the students or suggest the people who are giving the MRCG exam is that when you're doing the SPAs, first round, you go very quickly. So the ones which you feel, yes, you know definitely the answer, you attempt them, and rest where you feel you are getting stuck up or you don't know the question or you feel it is very difficult, you leave them temporarily and you move on. Once you finish one round, so the easy ones or the ones which you feel are easy or which you have attempted, then you take the second round and then you attempt the questions which are remaining. So that way you can take second, third, fourth round, and then so that makes it a little easier. That is what I feel. And EMQs try to spend as much time, because SPAs once are done, then move on to EMQs and try to spend as much time on EMQs as possible. So EMQs are basically designed to assess your clinical reasoning skills, your problem solving, and your diagnostic skills. Now, what is an EMQ? EMQ is basically an extended matching question. And because the number of options, the minimum, because the number of options in case of an EMQ are very large, so they become very difficult. At least I find them more difficult than SPAs. So what is the structure of an EMQ? EMQ stands for extended matching questions. So there is a lead-in statement or an instruction. So they will tell you that, okay, we will be talking about, say, clinical management, or we'll be talking about the diagnostic modality to be used in these various situations. Then they'll give you a question or scenario, and then there's a list of options. Actually, this is the first. The EMQ starts with the list of options. Then there's a lead-in statement, and then there are questions. So each EMQ, there will be 4-5 questions. So for example, you can see here, like these are the various options, and you can see the huge number of options till O. So these are the options. Then there's an instruction that you choose the most likely cause of death from the above list of options. So that becomes the lead-in or the instruction. Then there's a question that so-and-so presented with this, and what is the answer? So then you choose the answer from the given options. Now, again, the tip and trick to be involved by, so Sukriti Tandon, Dr. Sukriti is asking, will 1 year fellowship in reproductive medicine from a private hospital in last 2 years considered training for appearing in part 3? So 1 year fellowship, which private hospital? If it is a tertiary care hospital, because probably if you're doing fellowship in reproductive medicine, this would be a tertiary hospital. And if you have previously experience, you have MD experience or you have some clinical experience, this 1 year plus 3 years would be, yes, they should count it. Again, you can mail them or you can call them, and the better idea is to mail them along with the details. You will surely get an answer from RCOG. Okay. So now coming to the core curriculum for part 2. So core curriculum for part 2, there are basically 15 knowledge areas which are tested for part 2 exam. And this you can find it from the core curriculum for MRCOG. If you type this in Google, core curriculum for MRCOG 2019, then you'll get the PDF which will give you all these details, the knowledge areas which are tested. And also with each knowledge area, there's something called CIP. CIP stands for capability in practice. So CIP stands for capability in practice. So basically, the assessment, patient assessment, recognition, and management of a particular condition. So for each of this, antenatal care, you should be able to assess the patient, recognize her problems, and subsequently manage it. So that is the CIP, and with every knowledge area, you will have some CIP which you have to fulfill. So all this you can check for yourself from Google. You can download the core curriculum, and because that caters more or less to our MD standard. So there is a question by Dr. Saida. How many years of gap can we give after each phase of example after MRCOG 1, within how many years we have to clear MRCOG 2 and 3? So after giving MRCOG 2, I think it is 7 years that you should give within 7 years. The MRCG 2 is valid for 7 years. Within 7 years, you should give MRCG 3. And I think the same holds for MRCG 1 also. That once you've cleared MRCG 1, within 7 years, you should give MRCG part 2. So now coming to the format of MRCG part 3. So part 3 exam I told you is in form of OSCEs, and it is not really testing your clinical knowledge. Clinical knowledge they have already tested in part 2. Here what they are testing is your communication skills. And communication skills basically mean that whether they will not even ask you, unlike the USMLE pattern where the OSCEs you have to do clinical examination and so on. Here you don't even have to clinically examine the patients. Or even in PLAB where they ask you to clinically examine the patients. In MRCOG part 3, no clinical examination, just it's a verbal exam where they just are testing your clinical skills, whether your communication skills are sufficient that you are able to satisfy the patient or not, and whether you are able to address her concerns or not. This is basically what they are testing in MRCOG part 3. And there are 14 OSCE stations which are tested in MRCOG part 3. And they are testing 5 domains in part 3. And what are these domains they are testing? 1, communication with the patient and their relatives. 2, communication with the colleagues. So are you able to communicate? Are you able to convey properly the problem, the things to the patients and their relatives? Are you able to deal with their concerns properly or not? Because are you able to explain the patient what she's suffering from in clear language and clear terms? if you encounter a relative who is angry because maybe you have not, maybe because her patient has waited for very long and they are very angry about it. So are you able to calm them down? Are you able to deal with them? Or maybe there has been a mistake and because of which the relative is super angry. Or maybe there has been an IUD or something or a stillbirth and the patient's husband is very angry. So are you able to deal with such situations or not? That is communication with the patient and relative. Secondly, communication with the colleagues. Colleagues could be your junior colleagues, they could be your senior colleagues. So, are you able to explain your maybe junior colleague, somebody wants to learn the technique or the procedures or the maneuvers for breech vaginal delivery? Are you able to explain it to them clearly or not? Are you able to convey to your senior consultant what problem your patient is suffering from and why have you called your senior consultant in the middle of the night? Are you able to communicate properly with them? These are the kind of stations. Then, uh, first is this, second. Third is patient safety. Again, patient safety, is of paramount importance. You're not harming the patient in any way when you are giving them their treatment or when you are talking to them. Information gathering is, are you able to gather history or the information which you require to treat the patient properly or not? Application of clinical knowledge. This again is only 20% of your scoring is from application, whether you are able to give them correct management or not. In part three, the focus is more on your communication skills. Then each of the task is 12 minutes. So the exam is very tedious because there are 14 stations and each task is 12 minutes. And 12 minutes is 10 plus 2. 2 minutes they give you the preparation time where they give you the scenario and they give you the tasks which you have to do. And 10 minutes of time you have when you interact with the role player. Role player in MRCOG part 3 is basically the actor who is playing the role of a patient, because you will not encounter real patients in MRCOG Part 3. These are the trained actors. And since they are the trained actors, they'll give you clues. Somebody may profusely start crying during the when you're taking the history. Somebody might, become really upset. Somebody might act that they are becoming very angry with you. So because these are the role players and they have played this role for several exams, so they exactly know how to trouble the candidate. So out of these 14 stations, you will have 9 stations which are in form of simulated patient or colleague task. That means these will have the role player. And there will be 5 stations where there'll be structured discussion. This is similar to the Viva which we have in our Indian exams. So there will be an examiner who will be asking you the questions pertaining to a particular scenario. What happens in our exams? The Viva discussion. So that again will be for 10 minutes. And the role player tasks are also for 10 minutes. And each of them will have 2 minutes of the preparation time. So this is just to show you how the cubicle, so you can see that this is a setup. In this picture, you can see the setup for MRCOG Part 3 exam, and there are 14 cubicles. So you move into one cubicle, you are given the preparation time of 2 minutes. After those 2 minutes are over, then you interact with the role player and or the examiner. And then you move on to the next cubicle. As soon as the 10 minutes of time is over, the bell will ring and you have to move on to the second station, and so on and so forth. You move and you finish all your 14 stations. So now the method of part 3 exam is mainly in form of face-to-face discussion. In COVID time, the online format or the OSLER online format was being followed, which is now not being followed. Then another thing which happens is, so the various types of tasks. One I told you is the structured discussion. The other is the simulated patient task. So simulated patient task means there's a role player, there's an examiner who is watching you, and you are there. The candidate is there. So these are the simulated patient tasks. So I told you that the structured discussions are about 5 and these are about 9, the simulated patient tasks. And in the structured discussion, there will be the examiner and the candidate. So when you are interacting with the role player, the examiner is watching you. You are not supposed to interact with the examiner. You can just ask the examiner because like I told you that you are not supposed to do clinical examination. So if you feel that you need to know the clinical findings in a particular scenario, you can ask the examiner, can you please let me know the clinical findings in this situation? So he or she will tell you about the clinical findings in that particular scenario. Then there are some stations where besides the role player, examiner, and the candidate, there are also some people called lay examiners. So these will be 4 such stations. So out of the simulated patient task stations, there'll be about 5 where there'll be only one examiner, and there will be 4 where there'll be 2 examiners. So the lay examiner is basically somebody who is going to judge you or going to evaluate you from a non-medical perspective. So non-medical perspective means that whether the patient would want to see you again or patient would want to visit such a doctor or not. So that is a lay examiner. So more important than your clinical skills in this case is your communication skills and whether you come across as a good doctor to the patient or not. So again, just to explain again to you that in structured discussion, you can see that there is the candidate and there is this candidate and there is the examiner. In a simulated patient task, there is this role player. This is the examiner, the role player, and the candidate. So there are 3 people. But when there is a simulated patient task with the lay examiner, there are 2 examiners. So there is this one examiner. This examiner is the lay examiner. This is the candidate, and this is the probably the role player. So you can see that there'll be 4 people in such stations. So now I have finished discussion pertaining to the MRCOG structure and how do you apply it? How do you apply for the exam? So if there are any questions, you can please put them on the chat. Now it is important to develop a study plan. Like I told you previously also, at least 4 to 6 months of rigorous and focused study is required, and a lot of dedication, hard work, focus and determination is required. There'll be a lot of frustration also because you might not be able to pass the part 2 in one attempt. So you will have to go through all those stages, but it's important to keep your patience and persistence during this time. And again, motivation is the key. You should look at your ultimate goal that you will be able to pursue the MRCOG degree. So the method of studying for the exam, focus study is more important. You should know what you should study. So like I told you, the RCOG guidelines or the GTG guidelines. So if you are planning for your MRCOG exam and you are also in your residency, then you can start downloading your GTG guidelines right away. And while you are preparing for a particular subject, you also go simultaneously through the GTG guidelines. It'll help you in both the ways. Then the TOGs or the Obstetrician and Gynecologist, this is a peer-reviewed journal. the articles from BJOG, which is the British Journal of Obstetrics and Gynecology. So these are the free resources because all these you can download from the internet. Also, NICE guidelines or the National Institute of Clinical Excellence. So all these things become very, very important for people who are studying for MRCOG exam. Yes, that Dr. Ravi Kumar, that is the sad part that the fees is quite high. So if you cannot clear in one attempt, you have to pay the fees. We will be having after the end of my session, there will be a session taken by the marketing team. So Dr. Pramod wants to, where can I buy the MRCG Part 2 book by you? You can consult the marketing team, they'll guide you through the process. Okay. So again, time, because time becomes very important because I know your residency itself is a very hectic time. So you need to take out time and devote it. And more important in these cases is to be consistent. Consistency is the key. So try to maybe devote 1 or 2 hours you keep every day where you try to devote it for your studies every day. And even if you have a night duty or even if you are in your clinic, at that time also, because patients will not be there all the time. So a flexible course, maybe something, the course like we are offering, because you have all the flexibility to use it whatever time in between. If you get, you can go through the app and you can solve the questions, so that becomes a little important. So try to enroll in some course or some kind of study program where they offer you the flexibility. There is, Dr. Pramod is asking if we clear only part 2, is it helpful in any way? There is something called MTI or Medical Training Initiative, which you can probably find out from the RCOG website, because in that they send the hospitals, they apply to RCOG and to train the doctors. So you don't have to clear part 1 or part 2 also in that case. But if you have cleared part 1 and part 2, then it's a training initiative where they invite doctors from other countries to participate in their healthcare services. So maybe you can go through that route. That is the MTI, and that you can search from the RCOG website, Dr. Pramod. So this is just to give you a brief view of the courses which we are offering. Details will be shared with you by the marketing. Again, for part 3 also, there are basically 2 formats which we are offering, the non-interactive format and the live OSCE engagement. The live OSCE engagement, people who take this format, they get a chance to participate with the mentor and with the role player, and they get chance with 5 such stations. And if somebody is interested in the May exam, they have got a seat and they are interested in the part 3, then we'll be offering these structured discussions, these group discussions where they'll be able to directly participate with the mentor and the role player in March, April. Again, this is based on mutual discussion when the candidate has the time. Based on that, we fix the program. So I cannot announce the dates exactly right now. So So that was the end of my session. And we had promised to all the participants, whoever have attended this session, that we will be giving you access to nearly 50 plus books in OBG through a chatbot. And that chatbot is Dr. Wise. And I'm giving you a little information regarding that you can install the app Dr. Wise from App Store or Play Store. And you click on professional option to continue. Then you can register using your mobile number and your OTP verification. After successful registration, the content is available for searching any query. So please do try it, because nearly 60 books from GP's catalog, 60 books in OBG from GP's catalog, and it is a very good source of knowledge, because books on urogynecology, oncology, maternal medicine, everything is there. So I think it should be, because you being the exact audience who will really love this resource, I thought this would be a good, token of appreciation which we can give you. So I would request all of you to try this. This is available for free. And if you have some feedback, because this is still in the beta version, so sometimes it may not give you the correct answer. So if you are facing any queries, please do let us know, because that will help us improve. And just to give you a little screen recording of what is Dr. Wise is about, the app.
Hi doctors, I am Dr. Wise, delivering trusted knowledge innovatively. Here to take you on an all-new learning journey. A guide always has your back, and so will I. Have any doubts? Just type your question or speak it aloud. Follow up on your questions for more clarity and keep the conversation going. So that you don't forget the conversation, I keep the chat history on the side. You can pull it up whenever you like. Oh, here's something important that you must know about me. I don't just answer your questions, but also provide additional reference from authentic published resources like books, journals, notes, and videos. I am all ears for your honest feedback. Click to like or dislike. This will help me get better and grow. With my abilities, you can rise like a pro. Consider me your friend who will open up your window to a world of medical knowledge. So, are you ready to revolutionize your learning? If yes, then tag along on this journey with me to gain an edge. Let's get started.
It's similar to a chatbot like feature, and you will get reference to the books. You'll also get reference to the videos, and you'll also get the history like you get in ChatGPT. So I would request all of you to try it. It is a good feature. So that was all for this session, and thanks everyone for attending this webinar and making it fruitful. I'll address the questions which are here. Do we need to read TOG articles from 2009 or recent ones? Even GTGs, some are decade old. No, you just maybe just the recent ones. And for every topic, it's important. Some topics are like really important. For example, maternal collapse is important. Oncology section, the management is very important. Cervical cancer screening program is very important, because they have a proper screening program, and so they've been able to control cervical cancer. The endometrial hyperplasia guidelines are very important. Maternal collapse is really, really important. Postpartum hemorrhage, important. Varicella pregnancy, very important. So some of the topics, they are really important. That gestational diabetes, those you need to read. Maybe you can check the latest ones. There has been a recent update on, I think, hyperemesis gravidarum. So Dr. Ravi Kumar mentions that part 1 course worked for me. Looking forward to join part 2 course. Really grateful and really thankful to you for attending the webinar. So thanks so much for your all of you for attending, and thanks so much for